Do I have permission to use you as a case study for my kinesiology 6302 course?
Yes, you do.
Do I have your permission to videotape this assessment and share it with my kinesiology 6302 course?
Yes.
What was the injury you sustained?
A distal radial fracture of the right hand.
It should be noted that the fracture was intra-articular and non-displaced. Was an x-ray taken?
Yes.
Did the x-ray confirm the diagnosis?
Yes, it did.
How long ago did this injury occur?
2 months ago.
All right. Was the wrist immobilized with a cast?
Yes, 6 weeks.
6 weeks. Okay. So you've now been cast-free for 2 weeks, and you are 8 weeks post-injury.
Yes.
All right. I'm going to perform a series of assessments to determine the progression of your healing. The first assessment I'm going to do is a manual palpation of the distal radial bone, as well as the articulating bones, the scaphoid and the lunate. Can you hold out your hand for me? If at any point you have any pain, will you please let me know?
Yes.
Any pain?
No pain.
Good. All right. The next assessment I'm going to do is a passive flexion and extension of the wrist. Can you hold your hand out straight for me? Again, if you have any pain, please let me know. We'll start with extension. Any pain?
No pain.
Flexion?
No pain.
Very nice. All right. The next assessment is going to be an active flexion and extension. Can you hold your hand out straight for me? Can you actively extend at the wrist? Any pain?
No.
Actively flex? Pain?
No.
All right, hold your hand out straight. I'm now going to have you do an ulnar deviation. You can bring your fingers towards the pinky side. Any pain? And then bring the fingers towards the thumb side.
No pain.
Very nice. All right, with a distal radial fracture, a lot of times there can be entrapment of the nerves, especially the median and the radial nerves. So we're going to do a test to see if you have full function of the muscles. I want you to do a finger to thumb test. You're going to take your thumb to each of your fingers slowly. Very good. Any pain during that assessment?
None.
Very nice. All right. Also with the distal radial fracture, sometimes there can be entrapment of the arteries that supply blood to the hand. If you can hold your hand above your heart, I'm going to perform a capillary nail refill test. I'm going to pinch at the finger, taking the blood away from the capillaries. And the blood returned just fine so that there's no entrapment to the arteries. Right. Now to determine grip strength, I'm going to have you use this hand dynamometer. Go ahead and set it. Using your right hand, can you please squeeze as hard as you can? Squeeze, squeeze, squeeze. And relax. Very good, 75 pounds. All right, we're going to do that test again. And again, go ahead and squeeze as hard as you can. Squeeze, 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 and relax. Very good. We got 70 that time, so we'll go with the first score. All right, it should be noted that the client has also been given a patient-related wrist evaluation to determine pain during daily activities. That assessment and score will be used to compare to the post-assessment. The hand dynamometer test will also be used as comparison for the post-assessment. Other than that, have you experienced any pain in the elbow or shoulder related to this injury?
None. No.
Very good. Okay, thank you very much for the assessment. Thank you for your time.